The 10 essential public health services describe the public health activities that all communities should undertake. The first one is monitor health status to identify and solve community health problems. According to the IAFN, which is the International Association of Forensic Nurses, the definition of violence has been expanded to include intentional and unintentional injury found in individuals who seek health care following acts of family violence, intimate partner violence, child abuse, elder abuse, rapes or sexual assault, trafficking, youth-on-youth violence, gang warfare, terror, war, disaster, and violence in schools or workplace and prisons. Recognition of violence as a global health care problem is the first step towards solving this critical issue. The second is diagnose and investigate healthcare problems and health hazards in the community. Forensic nurses have the opportunity to improve health outcomes that result from violence. Forensic nurses are uniquely positioned in intersecting systems such as healthcare, community, and legal environments for early identification of patients at risk of victimization or perpetration of violence. The third is inform and educate and empower the people about healthcare issues. Increased awareness and education for all healthcare providers and attention to the effects of violence is provided in an effort to reduce immediate, intermediate, and long-term physical and psychological injuries that are associated with violence. The fourth is mobilize community partnerships and action to identify and solve healthcare problems. A primary goal of forensic nursing is to raise public awareness that violence is a public healthcare issue that impacts the healthcare systems and communities worldwide. To that end, forensic nurses promote interventions that prevent or confront the cause of violence and strengthen the healthcare response to those affected by violence. The fifth essential service is to develop policies and plans that support individual and community health efforts. Forensic nurses organize and participate in facilitating the development of policies and procedures that foster the implementation of prevention and intervention programs in response to violence. The sixth essential service is to enforce laws and regulations that protect health and ensure safety. Many programs are mandated to report abuse of people with disabilities to the authorities, as specified by state law. In many cases, reports involving adults are made to Adult Protective Services. Adult Protective Services can assist in understanding a particular program's responsibilities under mandatory reporting laws, including who is a mandated reporter, under what circumstances reports must be filed, and the appropriate processes to follow when making a report. The seventh service is linking people to needed personal health services and assure the provision of health care when otherwise unavailable. In California, the Sexual Assault Response Team, also known as SART, is a client-centered program that provides emergency response to reports of child sexual abuse, rape, and assault. A team of trained and certified professionals provides services to individuals of all ages, including children, adolescents, adults, parents, family members, and friends. Clients can be linked to medical services, psychological services, law enforcement, or legal aid services. The eighth service is to assure competent public and personal health care workforce. The Sexual Assault Forensic Examination Support Training, Access, and Resources, also known as the Safe Star Project, is part of a cooperative agreement with the Office on Violence Against Women. The IAFN, or International Association of Forensic Nurses, and the Southwest Center for Law and Policy. The Safe Star Project will train tribal communities, healthcare workers, to gather and maintain sexual assault forensic evidence for use in tribal, state, and federal courts, and to make appropriate healthcare and other service referrals. The ninth service is to evaluate the effectiveness, accessibility, and quality of personal and population-based health services. Forensic nursing, like any public health service, must utilize process and outcome evaluations. For example, if a sexual assault nurse examiner program, or SANE program, is curious if the program has positive effects on the client's psychological health, they must first look at what and how their services are being provided. The 10th and final essential service is to research for new insights and innovative solutions to health problems. Human trafficking, for example, is an ever-increasing global issue. Healthcare workers are often the only service professionals who interact with trafficked victims who are still in captivity. The Department of Health and Human Services has created programs to combat human trafficking and help victims of human trafficking.